Now to continued fallout over the decision to overturn Roe v. Wade. We're learning black women are more likely to have an abortion than white women, according to 2019 data from the CDC. They say it's largely due to health care disparities and access, and it's why experts say black women will be disproportionately hurt by abortion restrictions in North Carolina. WRAL's Chelsea Donovan dug into this issue and shows us what a team of local midwives are doing to combat this.
While we don't have a ban in our state just yet, this Planned Parenthood in Raleigh is extending its hours, expanding its services, and training more clinicians, all to prepare for an influx of patients, many whom are dealing with racial disparities.
92% of the counties in North Carolina do not have an abortion provider, an abortion clinic. And so we're going to see people that are most impacted in those areas.
And experts say a large majority of those women who are impacted or don't have access are black women.
We have to consider the cost of the procedure. It's going to be harder to access for folks who don't make as much money, who have lower incomes. So that certainly includes Black people and people of color. And then you also have to consider things like childcare.
Maya Hart, the North Carolina rep for Sister Song, a reproductive justice rights group, believes access is already difficult for black women and it could get even harder. In fact, black women make up 23% of the state's population, but about 49% of women who had abortions in our state in 2020 were black. Experts say black women seek abortions at higher rates, partly because of lower contraceptive access and partly because their pregnancies are more likely to have dangerous complications.
More black women are dying within the first year of delivering a baby than similarly positioned white and Hispanic women.
Stephanie Devane Johnson with Vanderbilt University and Dr. Jackie McMillan Bowler with Duke are also both nurse midwives. They believe pregnant black women are often afraid to speak up about pregnancy side effects or pains.
Black women are not listened to the extent that other races are.
The women and another professor at UNC have recently started a Black doula program to help make pregnancies easier and safer for women by providing emotional and physical support.
We have studies that show that having a consistent, continuous labor support makes a difference in outcomes.
Statistics also show that black women have higher rates of premature births as well as low birth rates. Chelsea Donovan, WRAL News, Raleigh.